Welcome to ATCM, the Emergency Medicine channel. So today we will discuss the topic regarding geriatric trauma. So geriatrics, it's an age of 65 years or older, and some have shown the mortality is increases by the 45 years of age. So the 65 age or more than 65 it's a geriatric age group, and the 45 years of age it will have a more increased mortality. So when you compared with the adult, in geriatric patients, they have a worse outcomes. Why? Because there will be a physiological changes that occurs with the aging, and even with the slow mechanisms of injury also, they have produces the serious injury and less able to compensate from the stress of injury, and there will be complications during treatment and the recovery. So due to these factors, they have the worse outcomes when compared with the adult. So some physiological changes that occurs with the aging, and the more susceptible to the serious injury even with the low mechanisms of injury, and less compensate from the stress of injury, and more likely to suffer the complications during the treatment and recovery. So next thing, the effect of aging and impacts of the pre-existing conditions. So the geriatric age group, they already having the pre-existing medical conditions, and there will be some physiological changes occurs in the aging. So these factors will affect the geriatric age group people. So that what are all the factors, and or the declined cellular function, it leads to the organ failure. It's a natural process of the aging, and impair adaptive and homeostatic mechanisms. It will cause the increased susceptibility to the stress of injury and pre-existing conditions. So these pre-existing conditions will impact the morbidity and the mortality of the patient. And next thing, so recent studies, it identified some 5 pre-existing conditions influence the outcome in the trauma patients, that is a cirrhosis, coagulopathy, chronic obstructive pulmonary disease, ischemic heart disease, and the diabetes mellitus. And next, this organ systems and what are the functional changes and what's the implications for care. So first, in the cardiac system, so in the cardiovascular system there will be a declining function. So declining function and decreased myocyte mass, and the atherosclerosis of the coronary vessels, and decreased sensitivity to the catecholamines. So by knowing these functional changes, the implications are there will be a lack of classic response to the hypovolemia, and there will be increased risk of cardiac ischemia and increased risk of dysrhythmias. So next is the in pulmonary. So in pulmonary there will be a decreased gaseous exchange and the decreased elastic recoil and decreased cuff reflex and reduced functional residual capacity. So due to that factors there will be a increased risk of respiratory failure and the increased risk for the pneumonia and poor tolerance to the rib fractures. So in geriatric patients the ribs will brittle, so there will be a there will be high chances of fractures, and also there will be poor tolerance to the rib fractures. So in the musculoskeletal system, so in geriatric age group, there will be a loss of lean body mass and osteoporosis, changes in the joints and cartilages, and loss of skin elastin and subcutaneous fat. So the implications are, so there will be increased risk of fractures and decreased mobility, and the risk of skin injury due to immobility, and increased risk for the hypothermia. So there will be a loss of lean body mass, osteoporosis, changes in the joints and cartilages, the loss of skin elastin and subcutaneous fat. It leads to there will be increased risk of fractures, decreased mobility, increased skin injury due to immobility, and increased risk for the hypothermia. And next, in the renal system, there will be a decreased glomerular filtration rate, a decreased loss of renal mass, and the decreased sensitivity to the both antidiuretic and the aldosterone. So the implications are decreased ability to the concentrate urine. So urine flow may be normal even patient is in the hypovolemia. So there will be a sensitivity to the antidiuretic hormone and aldosterone is decreased. So the urine flow may be normal even with the hypovolemia and increased risk of the acute kidney injury. And so these are all the system wise the functional changes and implications for care. Now we will discuss what are all the common mechanisms of injuries. So the mainly the common mechanisms of injury in geriatric age group is falls, motor vehicle collisions, burns, and the penetrating injuries. So we will discuss one by one. So the falls, it's a increased risk of falling with the age. The falls are the most common mechanisms. So for falls, it is the most common cause for the traumatic brain injury and the pelvic fractures in the geriatric age group. So the risk factors are advanced age, physical impairment, medications use, the visual, cognitive and the neurological impairment. So these are all the some risk factors for falls. And the environmental risk factors may be the loose rugs or poor light or the slippery or uneven surface. So these are all the environmental factors for the falls. And the next mechanism of injury is the motor vehicle collision. So the motor vehicle crashes are the second most common cause of injury in elder patients. So it leads to a cause of death. And the risk factors, slower reaction time, decreased or limited cervical mobility, and the decreased hearing and the cognitive impairments. So additionally, patient is having the medical problems. These are also some risk factors. So myocardial infarction, stroke, dysrhythmias. So these are all the additional risk factors. So next mechanism is burns. So the burns, it is a particularly devastating in elder patients. So high risk because of decreased reaction time, impairment in hearing and vision, and inability to the escape from the burning structure. So inability to the escape from the burning structure. So any spillage of hot liquids in the leg. Also any spillage of hot liquid on the leg, when you compare with the younger adult, so the younger adult, they may be re-epithelialized due to an adequate number of the hair follicles. Due to that adequate number of the hair follicles, any spillage of the hot liquids on the leg, in adults they may be re-epithelialized, but it will result the full thickness burns in the older patients. So it will result the full thickness burns in the older patients with a paucity of the follicles. So next mechanism is the penetrating injury. So penetrating injury is one of the cause for the traumatic death in a geriatric population. So many deaths associated with the gunshot wound related to the intentional self-harm or the suicide. So these are all the mechanisms of injury. So what's a common injuries we can see in the geriatric patients is head trauma, cervical trauma and the chest trauma. So in head trauma, so there will be increased fragility of the cerebral blood vessels. It leads to increased enlargement of the subdural space and decrease in the supportive tissue of the meninges. So these things will contribute the more vulnerable than younger person to the intracranial bleeding, particularly the subdural hematoma. So here there will be increased fragility of the cerebral blood vessels. So the enlargement of the subdural space and the decrease in the supportive tissue of the meninges, it all combines to make older adult, it's a more vulnerable to the intracranial bleeding. So the most important symptom of subdural hematoma, it's a headache that may worse at night. Sometimes the headache occurs at the same side of the blood clot. And next, with increased intracranial pressure, the state of consciousness will become depressed and patient become increasingly drowsy. So next, in the cervical trauma, so cervical trauma, the geriatric people, they are more vulnerable to the cervical spinal cord injury and compression, even with the minor trauma. So they are with sudden movement of neck also may result the spinal cord injury. So in the chest trauma, so increased risk for the rib fractures due to the anatomic changes of the chest wall and the loss of bone density. So due to that loss of bone density, there will be increased risk for the rib fractures. The most common mechanism for rib fracture is ground level for the motor vehicle crashes. So this, the main objective in the treatment is control the pain and the pulmonary hygiene. And next, assessment and management. So in assessment and management, it begins with the assess the and look the mechanism of injury. Look at the mechanism of injury. Always look for signs and symptoms that have the patient may have experienced the medical problems before the trauma. For example, a syncopal event while driving, it results the crash. So we want to know the any signs and symptoms before the trauma the patient is experienced. So the initial management of the injured geriatric patient, as usual, the primary survey, so airway, breathing and circulation, and we want to take some special concerns in the geriatric population. So in the airway, what we will take the special concerns in airway. So the geriatric people, they are having the dentures. So these dentures, if they are intact and in place, first leave them where they are, because it will help to achieve the good seal with the bag mask device. So the dentures, it's one of the considerations. So first they are in the intact and in a place, leave them where they are, because it will helps to achieve the good seal with bag mask device. So if the dentures are broken or loose, just remove the dentures and place them in a safe container, because it will cause the obstruction and aggressive suction of the blood or any other secretions. And next one is, in older adult, they have the significant loss of airway reflex. So the definitive airway management can be the life-saving, and arthritic changes which may make the mouth opening and the cervical spine management is the difficult, and edentulous patients, which makes the intubation is easier, but the bag mask ventilation is the more difficult in edentulous patients. So next, in the breathing part, so just assess the breathing, but check the fractures. If assisted ventilation is required, use the bag wall mask device, but only give the pressure is enough to inflate the lungs. Don't give the more pressure. It to lessens the chances of creating the pneumothorax, and administer the supplemental oxygen. So in this circulation, just remember, while evaluating the circulation in geriatric patients, what's a normal blood pressure in younger person, it may be hypotension in the older persons. So if possible, determine the patient's normal baseline blood pressure and the circulatory status. Resuscitation of the geriatric patients with hypoperfusion is same for other patients, but based on the appropriate fluid and the administration of the blood. So it's transfusion of the blood. So age-related changes in this cardiovascular system, the place the elderly trauma patients in a significant risk, being inaccurately categorized as a hemodynamically normal. So elderly patients may have fixed heart rate, because they are using the beta blockers, so they may have the fixed heart rate and fixed cardiac output. So the response to the hypovolemia will involving increases with the systemic vascular resistance. So the many elderly patients, they have the pre-existing hypertension. So acceptable BP may truly reflect the relative hypotensive state. So they are also they are having the pre-existing hypertension. So the maybe acceptable BP maybe reflects the relative hypotensive state. And the critical to identify in geriatric patients, it may be critical to identify the patient with significant tissue hypoperfusion. So the methods to use the making diagnosis is, first the base deficit, serum lactate, and the shock index. So based on these things, we can make the diagnosis with significant tissue hypoperfusion. And next, disability. So the pupil size, evaluate the level of consciousness, and depending on the protocol, and they use the hypertonic saline used to reduce the intracranial pressure in patients with asymmetrical pupils and the hypertension. And next, so older patients, maximum of the older patients, they are having the commonly prescribed by the antiplatelet and the anticoagulant medications for the pre-existing medical conditions. So these factors will place the individual at higher risk of the increased intracranial hemorrhage. So mainly in older patients, the mainly prescribed antiplatelets and anticoagulant medications for their pre-existing medical conditions. So these factor will place the elder population at a high risk of intracerebral hemorrhage. And the degenerative disease of the spine in the elder patients, there will be a high risk of fractures due to this degenerative disease of the spine. So the high risk for the fractures in elderly patients. So next, in the exposure, so we already discussed there will be a loss of subcutaneous fat, and the nutritional deficiencies are chronic medical conditions and the pre-existing medical therapies. These all things will place the elder patients in a risk of hypothermia. So next, after the primary survey, try to take the complete history of the trauma event from the patient or from anyone who may be witnessed the event. So for examples, if the patient is fell, so from what height, did the patient have any symptoms beforehand, such as the dizziness? So if the patient was struck by a car, how fast the car is moving, or if the patient was the driver of a car involved in a crash, did he or she feel dizzy or blackout before the crash, or did the patient is having the chest pain, and obtain the complete list of all the medications the patient is taking regularly. So especially about the beta blockers, antihypertensives, and medication for diabetics. So because of them affects the patient's response to the resuscitation measures and the anesthesia. So this complete history we want to obtain the from patient or from anyone who may witness the event. And next, what are all the things to remember here? Use the caution when inserting the IV catheters and administrating the fluids. So here, easy to overload the older person with sodium. So you must balance that risk that need to maintain the adequate perfusion pressure. And you, how will you decrease that risk is just use the small boluses and reassess the patient frequently, especially for the signs of pulmonary edema, and monitor the cardiac rhythms throughout the care of a patient. So be alert for any changes in the ECG. So take the steps to preserve the temperature in a geriatric patients. Regulation of temperature is slowed in the older adults. So these are all the things we want to remember. So there will be higher chances of fluid overload. So use the small boluses and reassess the patient frequently, especially for the signs of pulmonary edema, and continuously monitor the cardiac rhythm. So be alert for the any changes in the ECG and take steps to preserve the temperature in a geriatric trauma patients. Regulation of temperature is slowed in the older adults. So thank you.